I'm Dr. Rajnikanta. I am a pan-ophthalmologist. That means I deal with all kinds of eye problems, cataract, glaucoma, general ophthalmology, uveitis, vitreoretinal problems and other things. And I'm part of RK Eye Center, which was established in 1989. I would like to share my views on red eyes because every day we see at least 8 to 9 patients who come with red eyes and ask us to treat them, and it's quite a challenging thing because each one, red eyes can be due to so many reasons. It can be due to multiple reasons, and so it's very essential that we put them on the slit lamp, that is a microscope through which we see the condition of the eye, and we evert the lid to see whether anything is behind the lid. We look at the type of redness, the type of congestion, whether they have any discharge or watering or pain or anything on the cornea, which is the transparent part in front of the eye. So it could be due to various causes. We ascertain the cause by looking at the eye very carefully. We also take a history of any injury to the eye, because sometimes injury like a ball injury or a shuttlecock injury or a road traffic accident, these things can also lead to redness. But most commonly it is because of infection due to bacteria, virus, and some chemicals falling into the eyes also. People who work in factories, people who work in contaminated environment, they can also have red eyes. So we ascertain the cause of red eyes and we treat accordingly. Sometimes it's associated with pain and inflammation, that is the tissues of the eye are swollen up. Then we give them anti-inflammatory agents, painkillers, along with maybe antibacterial eye drops, antiviral eye ointment and other things, and sometimes we support them with oral medications also if it is indicated. So the clinical diagnosis is very important, which we do accurately, and we do give the correct treatment. We also have eye makeup. Many people use eye makeup nowadays, this mascara and eyelashes, eyeliners and other things, kajal and other things. Sometimes very old eye cosmetics which are used on the eye can also lead to an allergic form of eye redness in the eye, and the lids are also will be swollen up a little bit because of this. So we tell them we counsel them and tell them to stop this cosmetics for some time and then resume it with another brand or with a milder variety of cosmetic. And many a time nowadays we see red eyes due to computers. People who use the computers for many long hours, like 10 hours or 14 hours. Software engineers use it for 14-16 hours a day. It is compulsory for them to do so. So sometimes they can also come with a different form of red eyes, and this could be due to little dryness also. That is constantly when we are looking at the monitor, then we don't blink enough. The normal blink rate, that is the times we blink in a minute, is about 30 to 40. But it is found that people who use the computers or the system, they blink only 7 times a minute. So every time we blink, the tear film, there's a fine tear film in front of the cornea, and this tear film is replenished. It is a new tear film comes up every time we blink. But when we don't blink enough, the normal tear film dries off, and therefore it gives rise to dry eye syndrome or computer vision syndrome. Computer vision syndrome has so many symptoms like fatigue of the eyes, pain in the eyes, the blurriness of vision, headache, eye pain, and of course gritty sensation in the eye, sometimes watering also. And some people will ask us, dryness you say, and then still you have watering. That's because the quality of the tear film itself changes, which leads to water coming down because they're not blinking. Every time we blink, the water is resurfaced. That does not happen. There will be dryness sometimes along with watering also. So we counsel these people, these professionals, and tell them to blink more, and also to look at the distant object once in every 10 minutes, and maybe for a minute or so, then come back and start the work on the system, or even after every half an hour go out and roam around for about 5 minutes and come back and again work on the system. And they can also learn some eye exercises which we teach them. We teach them to look at the finger and take it up like this, and then we ask them to bring it down and slowly take it down like this, like that for 10 minutes. Then we do the same thing laterally. We started from the center, and they can take the the eye. They can move the eye without moving the head. The head should not be moved. Just look at the thing, and then again come back to the center. And again one can look at the other extreme side and come back like that 10 times. Then obliquely the same thing can be done, this way, then this way. Then we can also rotate the eye 360 degrees like this, like this, and that is clockwise direction. Then again anti-clockwise direction like this. So these things strengthen up the muscles which are inside the eye, and we teach them these exercises and tell them to do this once a day or maybe twice a day. All these things help in combating computer vision syndrome. We also have some kind of special food which we recommend for people who which will help the eye to be healthy. We all know that carrots are very good for the eyes because they contain beta carotene. Beta carotene is a natural product which gets converted into vitamin A in the body, and which is very essential for the well-being of the retina. There's this structure known as rods and cones. This especially is very important for the functioning of the rods, which are responsible for night vision. So carrots are very good. Green leafy vegetables are very good, like cabbage, lettuce, palak, or all green leafy vegetables. And also drumsticks are very good, very rich in vitamin A. And the drumstick leaves also, they call it moringa leaves or moringa kera in Tamil, and that is also very, very good for, very rich in vitamin A. Papaya is also very rich in vitamin A. Then those who are non-vegetarians, they can take eggs, fish liver oil, and liver is very, 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 very full of vitamin A, very good source of vitamin A. So non-vegetarians can take all those things. Of course, curds and cheese and milk products are also very rich in vitamin A. So vitamin A helps in not only the health of the eye, but also the skin and other parts of the body also. So we recommend this food to be taken every day in their normal diet, and so that they can they can plan out the diet, like today we have taken papaya, tomorrow we can have carrot, and the next day probably some green leafy vegetables during lunch or dinner. We can plan it out. That's not a problem. So regular intake helps very good healthy eyes as well as healthy skin. Vitamin D is also required for the functioning of the skin and also the eyes, so even that is recommended. Sunlight is a good source of vitamin D. When we are talking about sunlight, we should also talk about how to protect the eye from severe sunlight. So when you go in the sun, like summer, 42, 43, 44 degree Celsius, it would be better to wear a good cooling glass, or we call it dark shades, which have two properties. One is anti-glare property, and the other one is anti-UVA. The glass will absorb the UVA and UVB rays which come from the sun. Sunlight has got these ultraviolet rays, we call it. So this can absorb it or block it. So it is also recommended for computer users, this anti-glare coating glasses and anti-UV rays glasses, which are available in the market, and we can go for a good quality one. And whenever we go out, venture out in the sun, shopping, or we can avoid going out in the sun, but if we have to do that, we can wear these dark shades which have UV protection and anti-glare protection, anti-reflection coating also. And similarly, computer users can also use these special glasses to protect their eyes. So another thing about sunlight, I would say never to look at a solar eclipse with the naked eye because a lot of harmful rays come from the sun at that point of time, and it can burn the macula, which is the most important point of the retina. Similarly, one should not look at the solar eclipse through telescope, binoculars, etc. So for the same reasons, better not to even look at the eclipse during using a smoked glass or something like that. So that this will cause a solar burn in the macula, which is the most important point of the retina for good vision, central vision.